G'day Thrivers, so we're here with Tom from Posture Podiatry again, and I've been really championing it a bit to ask you this particular question because it's something that we see relatively often in the clinic. It's those really chronic, long-standing heel pain, plantar fasciitis cases. And it's something that can be really challenging to treat.
Yep.
We've got our own ways that we sort of treat it here with lots of exercise-based stuff and getting people really strong in their lower limbs, but sometimes it's not quite enough to get them that result they're after. So yeah, I wanted to ask you how you guys approach treating that tough condition.
No, absolutely. It's something we see daily as podiatrists. It's probably the most common presentation is heel pain or plantar fascia pain. So absolutely. I mean, in the early stages, if it's more of an acute injury, we often find that the taping, the exercises, the stretches, manual therapies, dry needling, and those sort of things can be really useful. But once we start to get past that 3-4 month stage and it starts to become a more chronic condition, as it can become in a lot of our clients, often we find that we need to do some more longer term treatments in an attempt to basically get the pressure off the heel and also allow for healing. So I guess two of the main ones that would be used probably on a daily occurrence within our clinic would be orthotic therapy is a very useful tool when prescribed correctly to, in essence, offload the painful side of the foot, and that can work really well in conjunction with exercises and so forth. The other thing that we're really lucky to have in the clinic is the use of a Shockwave machine. Shockwave therapy is something that's got more and more evidence nowadays for its use in chronic heel pain when used and prescribed in appropriate situations. So we're very fortunate to have the use of a Shockwave machine. Works in a couple of ways to promote healing, promote blood flow to the area, dull some of the nerves and reduce the pain sensation. So really useful treatment again for that chronic sort of heel pain. Never really used in isolation, but it's something that can be a fantastic adjunct and help to sort of tip people past that chronic stage into that healthy state. Past that, night splints, cortisone injections, surgical pinions, they are used, but often with shockwave therapy and orthotic therapy, in the vast majority of cases, we are able to get on top of it.
That's excellent, and that's so great to hear because it can be really frustrating for people, and it's not uncommon for people to have bounce between a lot of different therapists to try and find a solution.
Absolutely.
So I think a combination of getting them moving, getting them nice and strong, as well as your input there.
Absolutely.
I think should be a good way to treat it for most people.
Absolutely, because as you see, you'd see the flow-on effect from heel pain, knees, hips, other joints start getting issues as well. So
that's right, isn't it? Excellent. Thanks, Tom.
Thank you.
Beautiful.
Cool.
Yes.